back to Toast to Travelers.
Thank you for having me.
Yeah, thank you for being here. I'm excited to talk about mental health today because it is such a serious topic. I think I just want to start out by you introducing yourself, tell us a little bit about your background and what you do here at Next Move.
Gotcha. So I'm Caleb Skyles. I am the director of recruiting here at Next Move. I am also a registered nurse. I was a travel ICU nurse for about 5 years before joining Next Move. And I'm also an influencer here at Next Move. So I'm in most of the social media content. So yeah, should be familiar.
Yeah,
Right.
Yeah, a familiar face. So just a little disclaimer, mental health is such a personal experience. So just feel free to share whatever you're willing to share with us today.
Thank you.
I want to talk a little bit more about you switching from staff nursing to travel nursing, and do you feel like that impacted your mental health at all?
Yes.
Okay.
So in a positive way, and not in a way that like, hey, if you are struggling mentally, just switch to travel nursing.
Yeah.
Like, that is not a band-aid. Let's probably gonna fix a lot of things for you. You're always going to need to address whatever the underlying issue is.
Right.
But there's components of travel nursing that I think make you a little bit less susceptible to some of the burnout and things like that.
Okay.
Namely, I went into something that was 3-month contracts, more or less, 13 weeks, we'll say 3 months. And when you go into that, it's 3 months, it's a 3-month sprint, and then you can take as much time off as you want. So for me to be able to I usually took about 30 days off between every contract.
Mm-hmm.
It really gives you time to recharge and
Sure.
kind of reset, as opposed to you're doing this 52 weeks a year.
Mm-hmm.
I would say that is probably the biggest, and I'd say that's the biggest way that your work-life balance just is impacted. It affects your mental health. So
yeah. Okay. So if there was a clinician that was maybe on the fence about switching over to travel nursing, like what would be the advice that you would give if that person's struggling with their mental health?
Yeah.
Like give some more benefits.
For sure. So the first thing I would say is that if you are seeking a career change just to fix whatever mental health issues that you're dealing with, that's probably not going to be the thing that's going to help the most. The first thing that is going to be the most help is seeking help.
Mm-hmm.
So whether that's through therapy, a support group, there's literally a billion resources online now, or getting just with your primary care physician to talk about medications. I would be looking at going through that list, as well as maybe seeking a career change. So I wouldn't say it's a staff or travel, it's a travel, and I'm also going through the things that help me make sure that I'm taking care of myself mentally, getting myself the resources that I need.
Gotcha. Okay.
I think there was a question in there that was, what are the other benefits are there though for travel, aside just taking a break every 3 months? One is if you're like me, you get stressed out by the politics, of staff nursing, you're pretty much removed of those. Yeah, there is the typical day-to-day office politics, you want to call it, but not as many of the redundant meetings. You don't have to care about JCO as much, there's just certain things that you're absolved of when you're a traveler that I get to show up, I pretty much get to care about my patient assignment, make sure that I'm doing right by them, and then I get to go home. Right. I don't really have to deal with the back office administration stuff, which can honestly just be a big pain, add to the stress of things. So you're removing that a little bit. I think that there's probably another one that I'm forgetting in here that's really obvious. Oh yeah, you make a lot more money.
Okay,
so money does not solve everything.
Yeah.
But it does make things easier. So we know that if you're to survey 100 people about what they're most stressed out about for any survey, by the way, this is a study I'm pulling out my ass right now, but predominantly money, finances is really high up there. So this is it's a pretty easy way to at least remove a pretty common stressor for a lot of folks, which is, am I going to be able to pay my mortgage? Am I going to be able to pay off debt? Can I pay off my credit card debt, student loans, things like that? Removing financial burden is a pretty easy way to remove stress from your life. So I would say that is a pretty easy thing to point to and say that you can overall improve a little bit of your day-to-day stress levels just by doing that.